Dear ladies and gentlemen, I am Masood Saeed, a psychologist of mental health and well being. Welcome to my YouTube channel, Words of Inspiration. This video will be discussing about schizophrenia, bridging medical and Islamic perspectives. Understanding schizophrenia, a complex mental illness. Schizophrenia is a serious mental illness. It affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality. This can be distressing for them and their loved ones. Schizophrenia is a chronic condition, meaning it lasts a long time. It requires lifelong management. However, with proper treatment, people with schizophrenia can live meaningful and fulfilling lives. Schizophrenia affects about 1% of the population worldwide. It typically emerges in early adulthood. Men and women are equally affected, but men tend to show symptoms earlier. This illness is often misunderstood. There is stigma associated with mental illness in general and schizophrenia in particular. This video aims to shed light on schizophrenia from both medical and Islamic perspectives. We will explore its symptoms, causes, and treatment approaches. Understanding the interplay of these perspectives is crucial for providing culturally sensitive and effective care. Recognizing the symptoms: positive, negative, and cognitive. Schizophrenia is characterized by a range of symptoms. These are categorized as positive, negative, and cognitive symptoms. Positive symptoms are behaviors not seen in healthy individuals. These include hallucinations, delusions, and disorganized thinking. Hallucinations are sensory experiences that are not real, such as hearing voices or seeing things. Delusions are false beliefs that are not based on reality, like believing someone is trying to harm them. Negative symptoms are a decrease or absence of normal emotions and behaviors. These include flat affect, avolition, and social withdrawal. Flat affect refers to a lack of emotional expression. Avolition is a decrease in motivation and goal-directed behavior. Social withdrawal is characterized by a preference for isolation and a lack of interest in social interactions. Cognitive symptoms involve problems with thinking, memory, and attention. These include difficulty concentrating, remembering things, and making decisions. Cognitive symptoms can make it challenging for individuals with schizophrenia to function in daily life, especially in work or school settings. According to the Diagnostic and Statistical Manual of Mental Disorders, also known as DSM-5, a diagnosis of schizophrenia requires the presence of at least two of these symptoms for a significant portion of time during a 1 month period. Exploring the causes, a multifaceted approach. The exact causes of schizophrenia are still unknown. However, research suggests that it is a complex interplay of genetic, biological, and environmental factors. Genetics plays a significant role. Individuals with a family history of schizophrenia are at a higher risk of developing the disorder. Brain chemistry is also believed to be involved. Imbalances in neurotransmitters, such as dopamine and glutamate, have been linked to schizophrenia. Environmental factors such as prenatal exposure to viruses, birth complications, and childhood trauma may also contribute to the development of the illness. While genetics and biology are important, they do not fully explain the development of schizophrenia. Social and environmental factors also play a role. Stressful life events, such as trauma or abuse, can trigger the onset of symptoms in individuals who are genetically predisposed to the disorder. Drug use, particularly cannabis, has also been linked to an increased risk of schizophrenia. Understanding the complex interplay of these factors is crucial for developing effective prevention and treatment strategies. More research is needed to fully unravel the mysteries of this debilitating illness. Islamic perspectives on mental health beyond the visible. Islam places a strong emphasis on mental well being. The Quran and the teachings of Prophet Muhammad, peace be upon him, highlight the importance of seeking knowledge, maintaining purity of heart, and seeking help when needed. Mental health challenges are not viewed as a sign of weakness or lack of faith. Instead, they are seen as trials that individuals may face in their lives. In Islamic tradition, mental illness is often understood through the lens spiritual and physical causes. Spiritual causes may include the influence of jinn or supernatural beings, or sihr, which is black magic. Jinn are believed to be able to possess individuals, leading to changes in behavior and mental state. Sihr refers to harmful magic that can be cast upon someone, causing illness or misfortune. While these beliefs are deeply rooted in Islamic tradition, it is important to note that they are not universally accepted within the Muslim community. Some scholars and individuals may interpret these concepts differently or may not subscribe to them at all. It is crucial to approach these beliefs with sensitivity and respect. Dismissing them outright can alienate individuals who find comfort and meaning in these explanations. Instead, healthcare providers should strive to understand the individual's beliefs and how they influence their understanding of their illness. Navigating ethical considerations, respecting beliefs and boundaries, integrating Islamic perspectives into mental health care requires careful consideration of ethical principles. One key principle is respect for autonomy. Patients have the right to make informed decisions about their treatment, including whether or not to incorporate religious or spiritual beliefs. Another important principle is beneficence. Healthcare providers have a duty to act in the best interests of their patients. This includes respecting their beliefs while also ensuring they receive safe and effective care. Sometimes there may be conflicts between religious beliefs and medical recommendations. For example, a patient may attribute their symptoms to jinn possession and prefer seeking help from a religious healer rather than a mental health professional. In such cases, it is important to engage in open and non judgmental communication. Explain the benefits and limitations of both medical and spiritual approaches. Encourage patients to consider seeking help from both sources. Building trust and rapport is crucial. Acknowledge and validate the patient's beliefs without necessarily endorsing them. The goal is to provide culturally sensitive care that respects both the individual's faith and their mental well being. Case studies, culture, and schizophrenia. Case studies highlight the importance of cultural understanding in treating schizophrenia. A study in Somalia found patients often attributed their illness to jinn possession. Traditional healers played a significant role in their care. Integrating these beliefs into treatment plans proved beneficial. Another study in Pakistan explored families' experiences with schizophrenia. Stigma was a major barrier to seeking help. Families often hid the illness or relied on faith healers. The study highlighted the need for community education to reduce stigma and promote early intervention. A case study from the United States followed a young Muslim woman diagnosed with schizophrenia. She was hesitant to take medication during Ramadan due to concerns about breaking her fast. Her healthcare team worked with her to find a medication schedule that respected her religious practices. These cases demonstrate that cultural background influences how individuals understand and experience schizophrenia. It also affects their help seeking behaviors and treatment preferences. Healthcare providers must be aware of these cultural nuances to provide effective and culturally sensitive care. The importance of cultural sensitivity, a bridge to healing. Cultural sensitivity is paramount in mental health care, especially for schizophrenia. Culture shapes our beliefs about illness, help seeking, and treatment. Ignoring cultural factors can lead to misunderstandings, mistrust, and ineffective care. For Muslim patients, culturally sensitive care involves understanding Islamic perspectives on mental health, acknowledge the influence of beliefs about jinn, sihr, and the role of faith. Engage with patients respectfully. Inquire about their understanding of their illness and their treatment preferences. Provide information about schizophrenia in a way that resonates with their cultural background. Explore the potential benefits of integrating spiritual practices alongside medical treatment. For example, prayer, Quranic recitation, and seeking blessings from religious figures can provide comfort and support. Remember, cultural sensitivity is not about agreeing with all beliefs. It's about creating a safe and respectful space for patients to share their experiences and perspectives. By bridging the gap between medical and cultural understandings, healthcare providers can foster trust, improve engagement, and ultimately enhance treatment outcomes. Practical recommendations fostering collaborative care. Several recommendations can guide healthcare providers, policymakers, and educators in providing culturally sensitive care for schizophrenia. For healthcare providers, educate yourself. Familiarize yourself with Islamic beliefs on mental health and common cultural practices. Active listening. Encourage patients to share their understanding of their illness and their treatment preferences. Collaborative approach. Work with patients to develop treatment plans that respect their cultural and religious beliefs. Community resources. Connect patients with local imams, Islamic scholars, or community organizations that can provide support. For policymakers, culturally tailored services, fund and promote mental health services that are culturally and linguistically appropriate for diverse communities. Anti stigma campaigns launch public awareness campaigns to reduce stigma associated with mental illness in Muslim communities. Training programs support training programs for healthcare providers on cultural competency and Islamic perspectives on mental health. For educators, curriculum development, integrate modules on cultural diversity and Islamic perspectives on mental health into medical and psychology curricula. Community engagement, foster collaborations between universities and local Muslim communities to promote understanding and reduce stigma. By working together, we can create a more inclusive and supportive environment for individuals with schizophrenia and their families. Integrating perspectives towards holistic well being. Addressing schizophrenia requires a holistic approach that integrates medical and cultural perspectives, recognizing the interplay of biological, psychological, social, and spiritual factors is crucial for providing effective and compassionate care. For Muslim individuals with schizophrenia, integrating Islamic beliefs and practices can be an important part of their healing journey. By respecting their beliefs, understanding their cultural context, and collaborating with them in their care, healthcare providers can empower patients to live meaningful and fulfilling lives. Ultimately, the goal is to provide culturally sensitive care that addresses the unique needs of each individual. By bridging the gap between medical and Islamic perspectives, we can work towards a future where everyone with schizophrenia receives the support they need to live healthy and productive lives. Do not forget to tap on the like, share, and subscribe buttons. Please leave a comment